Good afternoon, everyone. I'm Cynthia Minkovitz, and Josh Arstein and I are delighted to introduce our distinguished guest for today, Dr. Howard Bauchner. Now, this won't surprise any of you, but I get the serious part, and Josh gets the fun part, so we'll give it a go. So, Dr. Bauchner is a world-renowned pediatrician, academic leader, and distinguished member of the National Academy of Medicine. He served as Editor-in-Chief of JAMA and JAMA Network, overseeing one of the most remarkable periods in academic publishing. And under his leadership, JAMA's impact factor and global reach grew substantially. The family of journals expanded with many new titles, such as JAMA Oncology, JAMA Cardiology, and JAMA Network Open, and many innovative formats, podcasts, digital enhancement platforms, all were introduced as really leaders in the field across a huge array of medical and public health and other journals. He strengthened editorial rigor, transparency, diversity, and ethics in medical publishing. He's a distinguished scholar and dedicated mentor with over 300 peer-reviewed publications, and they span a wide array from pediatric health, quality improvement, and research integrity. And his vision has really shaped how clinicians, researchers, and the public actually access, interpret, and trust medical evidence. And you've left a really lasting and indelible impact in such a wide variety of fields. So that is the serious part, and we're so honored to have you here visiting with us. And now, Josh, you're going to give the real story, right?
I'm going to pick up, thank you so much, Cynthia. I'm Josh Arstein. I'm in the Department of Health Policy Management and Vice Dean for Public Health Practice and Community Engagement, and I'm also a mentee of Dr. Bauchner. So I'm going to pick up where you said great mentor, and I was thinking about that a lot last night. It's hard when you're in it to really realize the people who really influenced you and the impact they've had on your life. And as I was thinking last night, I was thinking about all the different ways that Howard has had that role for me and for Chobanian, who was also in our same fellowship program. For me, I remember interviewing, actually he interviewed me for residency, but I won't tell you that story. But he interviewed me for fellowship. He was overseeing the fellowship program as the head of general pediatrics at Boston University. And this was a fellowship program that was designed to put out researchers. People were supposed to write their K award during the fellowship program. And I had gone to Harvard and I had interviewed for a fellowship there. And I said, well, I'm really interested in policy. And, I think I'm interested in research to understand it, but I want to, make a difference for kids in different ways. I'm a pediatrician. And at Harvard, they said, we're only training researchers. And I got up in the interview and I said, thank you, but not interested. And I didn't know whether this exact, program, what it would be like at Boston University. And I met with Howard and I said, this is what I want to do. And he looked at me and he said, will you write a paper? And I said, yeah, I can write papers. And he said, well, then that's great. I think we need people like that. We need people like that who are trained. And he was an incredible mentor to me in my career and to Chobanian. And we have been, if you think about it, very different ends of the public health spectrum. Chobanian, an insanely successful researcher, doing, remarkable work, understanding so many elements of birth outcomes and so many other issues. And, I've had a completely different kind of career. I remember at one point I had submitted an abstract, and I was very proud of the abstract. And he said, well, I want to see the publication. That's what Howard said. And this was an abstract about children who were stuck in the pediatric hospital because there was no place for them to go for psychiatric care. They all had severe mental health needs. This is unfortunately not a problem that has gone away. And he said that to me the day I was calling the Boston Globe to try to get them to cover the abstract. And within a couple of days, there was a front page story about the huge scandal that we had uncovered, that all these kids were there and that the Medicaid program was sort of facilitating this. And I dropped off the newspaper and I said, does this publication count? Which was important because the other researchers then decided it was too controversial after the governor got upset to actually publish the paper, but he understood that too. So we did do some scientific publications, but I can't tell you at that point in my career how important it was for somebody to validate direction that I wanted to go and be helpful. And then later, I watched him quite a lot at JAMA. And I should say in my fellowship, it's idea, 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 but without the pressure. That's what a great mentor can do. You know, a mentor who comes in and says, here's what you should be doing, here's my idea, this is what you should be working on, that's hard, you know, and can push you in a direction you don't want to go. But idea, 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 we did some papers together on some of those ideas. But then I saw at JAMA, it's like idea, 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 so many different things that JAMA led the way on, and so much support for so many of the people that he brought in to that world. So it's particularly meaningful for us to host him. I want to thank Chobanian for the partnership in bringing here, and really deeply thank Howard for everything.
It's a privilege to be here. So firstly, I want to congratulate you on your ranking as the best public health school in the country. These rankings, everyone goes, well, they don't count that very much. It's like impact factor. We all pay attention to them, so congratulations. I just, two comments first about Josh and then Chobanian. So Josh is right. He did drop off the article in the Boston Globe on my desk and said, does this count? But he didn't finish the story, which was that it led to an expansion in the number of beds that were available across the state. So careers come in all different flavors, and I'll talk about this afternoon when we talk about career development. But I would say both Josh and Chobanian have been hugely successful, but in very, very different ways. And just a comment about Chobanian. In 2001, the U.S. launched a national children's study at a cost of $1.3 billion. It's delivered nothing. It was a failed experiment for many different reasons. But in 1998, this first-year faculty member came to me and our then chair and said, I want to start something called the Boston-based cohort of newborns in 1998, and that was Chobanian. So over 30 years ago, she recognized if you really wanted to understand children's disease, you need to start it in the newborn period. And that birth cohort still exists 30 years later. And it's in part why she has last year received one of the 10 autism grants. And the other thing that's remarkable about that birth cohort is unlike most birth cohorts in the United States, and there's very few, or around the world, it's extraordinarily diverse. Actually, it's more representative of low-income people than high-income people. And it's been an extraordinarily rich database for investigation over the last 30 years, and it's a tribute to Chobanian and her personality. Turning to my talk, I'll try to finish at about 12:50 or 1:50, whichever the time is, because I want to leave some time for questions. We're facing a crisis in research integrity, and I will try to point that out as I go along. It's gotten much worse over the last 3 or 4 years with fabricated references, fabricated authors, fabricated research letters, and an extraordinary increase in the number of retractions going forward. Now, is there a clicker here, or do I just touch the screen?
It is a clicker.
Oh, I just touched the screen. There we go. Got it. So fundamental change in the relationship between authors and publishers. So what do I mean by that? Traditionally, if Josh had sent a paper into a medical journal that was not open access, the journal would make a decision about whether or not to publish that manuscript. If we chose to publish that manuscript, we would own that manuscript. Josh would have no access to that manuscript, and access to that manuscript would be governed by the publisher themselves. So we would, in general, lock it down. And then publishers would generate dollars by selling the manuscript or reprints, selling the journal itself to either individuals or libraries. Open access fundamentally changes that relationship. Now, Josh would send the article into a journal that is open access or has an open access alternative, and then we decide if we want to publish it. And then if we agree to publish it, we then send him a bill. That bill could be $50 or $11,000, okay? Nature Communications now charges somewhere between $6,000 and $8,000 per manuscript and generates about $55 million of income for Elsevier. So open access publishing has become a huge, profitable business. And so the fundamental relationship changes. And, whoops. PubMed Central is a repository, which is very, very different than medical journals, which are communication networks. So even though the White House has said, loading your accepted manuscript, not your published manuscript, in PubMed Central is appropriate and reasonable and fulfills the mandate, I don't think it's consistent with the open science philosophy. There's very significant unethical or ethical dilemmas. In some regards, open access publishing is just like US healthcare. The more you do, the more money you make. And so this creates a very difficult ethical dilemma. So JAMA Network Open, when we started it, it's a fully open access journal. One of the central concerns was we started it with a business model. They now get 20,000 submissions a year and publish about 1,500 articles. If they published an additional 1,500 articles, the income to the AMA would be 1,500 times $3,500. So you can see how it creates an ethical dilemma for editors, particularly if they don't have much control over editorial independence from their publisher. And that's why open access has created its own problems. And interestingly enough, the Gates Foundation, which was an early proponent of open access, no longer covers open access fees because they don't believe it's accomplished what they had hoped it would accomplish. Unanswered questions: has OA benefited scientific discovery or improved patient outcomes? I generally think the answer is no, but I think that's worthy of debate. And OA 1.0 is mature, and the question is, what does OA 2.0 look like? And I'll return to that a little later on. So I would argue no preprint server should ever post an article that suggests there's a relationship between vaccination and autism, because there's 20 years of data to suggest that there is no relationship. So I would argue that that article should undergo formal peer review and never be posted on a preprint server. And the problem with the preprint servers is they would like to just simply pass through everything that comes into the server without much critical review. And that makes me somewhat uneasy, in part because if you give me a data set, tell me what relationship you'd like me to find, I can find that relationship. So, for example, Chobanian publishes a randomized clinical trial. I then want access to her data. First, how do I get access to her data? Do I email her and she sends it to me? Does she send me the code book about how she coded every variable? And then, do I want access to try to get more information, or do I want to reanalyze what she did and say what she did was wrong? So there's a lot of ethical dilemmas that really people haven't talked about data sharing. Plus, when I ask her for all that information, am I paying her? She's put a lot of time into it. So Joanne Manson published the major vitamin D clinical trial a few years ago, but she had 10 secondary outcomes that she really wanted to analyze. So how soon should she be forced to share those data? She really had a whole research plan over a 5-year period after the randomized clinical trial was completed. So these are a lot of the complex issues that have not yet been resolved. And so ICMJE 2016 sought feedback from research community, 300 plus comments. Major issues were, as I've already mentioned, timing, cost, and intellectual credit. I always find Canadians to be the nicest people in the world, and I can understand them. The Irish are also very nice, but I often can't understand the Irish. But I can understand the Canadians. And we got a letter from a group of very senior Canadian investigators when we talked about sharing the data from randomized clinical trials, and they told us that they thought we had lost our mind. And so these were people who I have a lot of respect for, who are often very, very nice. There was a report in JAMA Network Open in 2021, 487 reports of randomized trials in the major journals. Authors of NIH-funded studies most likely to report sharing data than those funded by industry, 89 versus 61%. But only 17 of the 89 studies in which authors committed to depositing the data in a repository had actually deposited it in a repository. So we don't really know how much data sharing is occurring. And authors of 43% said data were available upon request. I think going forward, for example, if you need to share data based upon an NIH mandate, it should never be upon request. You need to figure out a repository to put it in so that repository can safeguard your data and requests for those data. And it also relieves you of the burden and responsibility of data sharing. I think investigators have to work with industry to be more supportive of data sharing. And I just want to comment, there's actually 2 websites that do post data from industry. One is called Vivly, and the other one is called Yoda. Vivly is Harvard-based, Yoda is Yale-based. And they do and have worked with industry to try to allow them to share more of the data from their clinical trials. I want to turn now and he submitted a paper to Nature, but he was concerned if he submitted it with all of the data that it may not be published. So he didn't submit it with all of the data. And what he did is censor himself. He was looking at the relationship between climate change and wildfires in Canada and found that there was such a relationship. But he acknowledges that he purposely left out other potential confounding variables, because then potentially he wouldn't find a relationship and then Nature would not be interested in it. That's just extraordinarily disturbing, that an investigator would purposely leave out confounding variables because it would tell a different story. But I'll return to that about my great concern about observational cohort studies, both prospective and retrospective. We know that evidence-based guidelines, often assessed by grade from the McMaster group, fundamentally differ. So if you look at screening recommendations, particularly for prostate cancer, breast cancer, and colorectal carcinoma, they vary dramatically. And I think this both confuses the public and leaves us with unanswered questions about why do they vary so much. One of the challenges is that oftentimes people are looking at slightly different evidence bases. So if one guideline is published in 2024 and the other one is published in 2026, one may not expect the recommendations to be identical. But one of the other great challenges is there's no data on the reliability of the grade assessment. And that is of concern to me, that if you gave 2 groups identical data to look at, would they come up with the same evidence-based recommendations based upon grade? Obviously, we have the remarkable politicalization of science. So should BMI be replaced, for example, with waist circumference is one example. Obviously, I don't think I need to tell anyone about the politicalization of gender-affirming care. The dietary pyramid, I was so struck by all of the articles about the dietary pyramid. The reason I didn't worry about it is I don't think any single American pays any attention to the dietary pyramid. So I didn't understand why people were so worried about why it being reversed or this or that. We haven't followed them for the last 30 years, so why does anyone think we'd follow this one? And then, of course, alcohol. Now, I like wine, so I don't believe that moderate drinking has any impact on my mental health. But I'm assuming you know that there's been 2 competing major recommendations about alcohol that differ from one another. And here I think it may have an impact on how the public thinks about drinking. And then obviously vaccines, and sadly I believe that the Trump administration has done a brilliant job for the wrong reason around vaccines, because they did 2 things. First, they relentlessly questioned the evidence base of vaccines. And so they made rational, reasonable people say, does my child need rotavirus? Does my child need varicella? But then they did a second thing, and this was the more brilliant portion of their argument, that parents have a right to shared decision-making. So you pollute the evidence base, and then you hang your hat on shared decision-making. Well, that has made life for pediatricians very, very difficult. And I would just remind people, this is not an issue of the right. Most of vaccine hesitancy came from well-meaning, left-leaning individuals. So if you look at the data, like in northern portions of California, vaccine rates were much lower than they were in Alabama or in Mississippi. So this was not just an issue of the right, although they've capitalized on it in ways that I find to be close to immoral. Clearly, authors have strongly held beliefs. We have our own biases and prejudices. So there's someone who's written extensively that he simply does not believe that mammography saves lives, actually. And there's probably good data that mammography doesn't save lives. It may detect cancer, but whether or not it improves life expectancy is a slightly different question. Well, sending him any article on mammography is wasted time. He's made it clear he has a fixed belief. So reviewers and editors have their own biases. And then journal editors have their own strongly held beliefs. And then one other comment. Years ago, we used to think about number needed to treat. And I think this is the way that journals in the medical community really mislead the public. So the number needed to treat for statins, probably the most important drug in the world prior to the introduction of all these obesity drugs, is 1 in 20. For the obesity drugs, the number needed to treat, depending upon your outcome, is at 5%, 10%, or 15% body weight loss, is between 1 in 3 and 1 in 8. But when we publish it, the headlines are successful trial. But it's not a successful trial for the majority of people who are taking that drug or having that device. Actually, it's a minority. You never have a number needed to treat of 2. It's a very hard concept to deliver. So there was a very important article in New England Journal about the recent COVID vaccine and how protective it was. And it was like 50% protective in elderly against hospitalization. But if you looked at the relative and absolute differences, the number needed to treat was 5,000. But it wasn't published with a number needed to treat of 5,000. Well, if we really believe that people have a right to all of the data, I think you could say it was a 50%, 57% reduction in hospitalization, but the number needed to treat was 5,000. Although those are both accurate statements, I think the public would consume them very, very differently. So the question is it possible to have a reasoned discussion about vaccines, gender-affirming care, the Great Barrington Declaration, the use of BMI or screening for social determinants of health? Is it possible to have a rational discussion without it disintegrating to accusations about people's political or ethical beliefs? For example, there's very little data to support screening for social determinants of health. Very, very little data. The one piece of data that's very true is if practices begin to do it, rates of burnout on different scales go up. So people need to think when you're saying practices should screen for social determinants of health, what does it really mean? And then When I was much younger, journals used to say, is your financial relationship more or less than $10,000? And then we would declare it if it was more than $10,000. At one of the first meetings that I had with the JAMA Neurology editorial board, it was interesting. It was then called Archives of Neurology. One of the board members said, well, I always make sure that all of my industry relationships are under $10,000 so that I don't have to declare them. Kind of an interesting comment. Do you know that a lot of academic physicians make $100, $150, $200, $300,000 in consulting arrangements? I somehow think the public thinks there's a difference between a $20 lunch and $300,000 in consulting relationships. And I'm worried that, again, we're almost ashamed of the size of these financial relationships. So journals no longer ask for any declaration of the amount, just whether or not you have a potential conflict of interest. And it's even worse in podcasts and social media, where there's never any declaration of a conflict of interest. So when you're listening to a podcast by a so-called expert, you have no idea if they have any relationship with a company or a startup. There's almost no declaration, either in journals or independent podcasts on Substack. And I think we need to understand what that really means for the public that's trying to trust us and trust our advice. And for me, the reason it's so problematic is when I started at JAMA, we had 15,000 followers on social media. Now JAMA has 1.5 million. So an article published in JAMA, New England Journal, Lancet, Science, Nature, it goes around the world within minutes of it being published, and you often see it on the front page of the newspapers. So I was struck by the JAMA paper that said if I drink more caffeine or drink more coffee, I'll be less demented, okay? That was on the front page of almost every newspaper in the United States. I still don't believe the results, and I was very disappointed that red wine wasn't in the analysis. That's what I was more interested in. So And I will suggest that this is unequivocally the future. We will move to a system where every manuscript, prior to decision about whether or not it should be rejected or go out for peer review, will undergo review by AI. I do work with a company in Australia. I declared it. It's called Paper Wizard. If you use it, I don't make any more money, but I am a consultant to them. I've also used all of the large language models. And as you can see on the last bullet, regardless of what journals are saying, most or at least half of people who are asked to conduct peer review are now using large language models. Now, there's a huge problem in using large language model, because those data then become part of the corpus of that large language model. Now, there's apparently ways, both with ChatGPT and Claude, to turn that off, but I'm not smart enough to know that. So if you do use a large language model, you're likely violating the rules of journals, okay? So just be conscious of that. I have to say at Paper Wizard, which is really, gives an extraordinary report, they do not hold on to your data. It is not used to train their model in any way. I would not have worked with them unless they agreed to that up front. But I believe that what's going to happen is a manuscript is going to come in for peer review. It will undergo plagiarism software, check whether or not the references are authentic, and undergo AI review. At that point, an editor will decide, send it back to the author for corrections, send it out for peer review, or reject it. I think the goal is to reduce the number of peer reviewers that are necessary and allow peer reviewers to focus on things that they're good at, rather than asking them to do many different types of activities which they're not very good at. In the cognitive psychology literature, that it's been very hard to replicate studies that were done 10 years ago. I would argue that I have no reason to believe that they could be replicated. Why? Because the way people process information today is very different than 10 years ago. So I've been surprised that the cognitive psychology world has been so self-reflecting on how poorly they're doing. I'm just not sure they're holding themselves to a standard that no one would want to be held to. Now, that's very different than if you do a lab-based experiment today and you do that lab-based experiment tomorrow, that you get the same results. It would be like measuring hemoglobin A1C and it not being reproducible. You would hope you'd get the same measure or the same measure within confidence intervals. And so replication and reproducibility are very complicated concepts that I don't think we've really flushed out. AI and authorship, I would only say all of the journals have now said the same thing after initially saying AI should not be used. I genuinely now believe that AI will fundamentally alter scientific discovery and scientific communication. I do hope it relieves clinicians of administrative burdens, but I'm still not entirely sure about that. There's an important paper published in JAMA last week that says when you use AI scribes, you save about 10 minutes a week. Not that much time. So I'm still uncertain about how much it's going to help clinicians with administrative tasks. So open science in the future, open access in various forms will dominate. A lot of money involved, tens of millions of dollars. Data sharing is much more complicated than open access. Much of scientific communication will remain unregulated and sadly influenced by strongly held beliefs. To me, it's the weaponization of data. Peer review will radically change with AI married to human peer review. And then I remain entirely unsure, even with a change in administration, hopefully in a few years, if we'll be able to restore faith in both medicine and science. Thank you very much. Time for questions and feel to ask anything. I'm happy to entertain any questions. Cynthia.
Awesome talk, and it sparks a lot of conversation. I was wondering if you could comment. What do you think is the role of academic institutions to sort of propel the open access conversation, come to different solutions, as opposed to, say, specialty societies that may have a vested interest in the outcome?
Yeah, so the question was, what's the role of a place like Hopkins, a school of public health, a medical school, versus publishers and academic societies around the role in open access? There are obviously legitimate open access publishers, and I think this notion that science should be free to the larger community of science and the public is a noble approach. As I said, I don't know if it's noble enough so that you don't need to evaluate it. And it certainly has had many unintended consequences. So I think it's perfectly reasonable for the academic community to largely be supportive of open access publishing, and you are.
Howard, would you stand behind the mic so people online can hear you?
Sorry, Josh. I suspect the larger Hopkins community is spending between $5 and $10 million in open access fees a year. So you are supporting it from a financial standpoint. I think it starts with two things. There's so many journals, you're always going to be able to get something published. And I think you really need to think twice about if your manuscript's been rejected 2 or 3 times, maybe it's really not worthy of being published. That's a hard thing to say to a junior person particularly, but maybe it really isn't worthy. And so you shouldn't look at the least common denominator open access journal that's $200 so you could get published. So I think it starts with our own behavior. And the other is obviously only to publish in what generally most people concede are reputable open access journals. I am unequivocally biased. JAMA Network Open is without doubt the best open access journal in the world. And why do I say it? Because it has 20,000 submissions. It has an acceptance rate of about 8%. It has an impact factor of 10. And every single article in that journal is processed in the same way as articles at JAMA. So I give the AMA a lot of credit. They gave us the financial resources that cost them millions of dollars to process those manuscripts in the same way as manuscripts across all of the other network journals. That's not true for a lot of open access publishers. So if you have an open access journal and its acceptance rate is 60 or 70 or 80%, I'm concerned about how legitimate it is.
Yeah, thank you so much for this incredible talk. One of the things that I've been having many discussions about with faculty, particularly junior faculty, thank you, are the high costs of these journals. I mean, some as high as $12,000. And so if faculty members, especially those that are working in soft money institutions, that I've heard now they're no longer going to be going after these high impact journals because they simply can't afford it. And instead, they're going to start to publish in these lower tier journals. And that has a ripple effect. What's going to happen to promotion, all of these things. So I'm wondering if you could comment on that. What's the future?
It's so troubling. So I'm stymied in trying to sort through the way of answering the question. So as I said, Cell is $11,000. Nature Communications is, I think, $7,500 or $8,000. JAMA Network Open is $3,500. God, it feels like a bargain. Institutions like Hopkins makes complicated relationships with the major publishing houses. So oftentimes your fees will be waived if they've entered such an agreement. So you always have to be conscious of talking to, these agreements are usually part of your library services. So that's the first thing. You really have to understand if you have these translational relationships where Hopkins has paid Elsevier $5 million for access to all its journals in return for waiving a certain number of fees. So those are really important issues to understand, and your libraries can help. Oftentimes that's not the case. It's very hard though for Nature Springer or Elsevier, if they get a request from someone at Hopkins for them to say, well, I don't have enough money to pay the fee. You can go that route, but from the publishing standpoint, they're looking at Johns Hopkins and going, really? They don't have the money to pay the fee? So you can imagine that there's natural tension around that. Almost all of the journals will waive the fees for low and middle income authors, but you would not qualify as coming from a low and middle income country. So there's been some protection for authors from those institutions. Fees are not going to come down. And I understand the tension about publishing in less influential journals, because then when you're trying to climb the academic ladder or you're trying to get your grants, publication in the more influential journals really become valuable. I'm going to talk about that in my seminar this afternoon about building a career. What I would say is early in your career, you need a certain number of publications for people to be vested in you as a scientist. As you move further along, it becomes more important to publish in higher quality, more influential journals. I don't know what the right number is at the beginning, but at some point, I think one has to try to identify the more important journals in your field and try to publish in them and try to work through the cost of those publications before you submit the paper. Before I went to JAMA, I was sitting in my office and someone walked in and said, I just had a manuscript accepted. I said, that's fantastic. And she said, do you have a spare $3,500? I'm doing the math in my mind, like my group published about 80 manuscripts a year. I said, Christ, what do they think I print money here? So I realized then, this was like 20 years ago, that God, this was a whole new area that I didn't understand. I obviously came to understand it pretty quickly when I went to JAMA, but I share the complexity of the question, and I'm not sure I have a very good answer.
I actually had a related question to Kristen. So yes, the fees absolutely have a ripple effect on on one's academic career. But it seems to me that it feels the opposite of what open science is designed to do, because it will necessarily enlarge in the disparities. So the investigators or institutions who can pay will pay and be published and submit their papers there, and the people who can't won't. And so, yes, now we have an open science system that is necessarily, essentially biased, because the people who are doing other research that may be really important and exciting can't afford to pay fees. How does this help open science?
So I think people have worked hard to protect authors from low and middle income countries. So the reason I never thought open access publishing was that important was because the major publishing houses, if your IP address is from a low and middle income country and it falls in the 150 poorest countries, you get free access to those journals, okay? So for 20 years, we've tried to protect scientists in low and middle income countries. So that's why when people said, well, open access will give more access to people in low and middle income countries, I said, well, for the major publishing houses, they actually already have access. So I thought people were confusing a number of issues simultaneously. I don't think anyone anticipated the dramatic and positive impact it would have on the bottom line of the major publishers. I mean, it's just been extraordinary. Really, I'm talking about tens of millions of dollars. The goal for every journal now is to ensure that they have an avenue to publish that manuscript so that it never leads that group. Lancet has 26 or 28 journals. Nature has 30 journals. JAMA has 15 journals. New England Journal has finally entered the game. They have 4 journals. I was with Richard Smith once, Richard Horton, who's the editor of Lancet, and this is after they had launched 4 or 5 journals, and they announced they were going to launch another 10. I said, Richard, Christ, you're giving birth to a journal every month. I can't keep up with you. He said, hey, on one day you got 9 new journals, so stop complaining, because we renamed all the journals in one day. So there is this competition, and I think we've done a good job trying to protect scientists in low and middle income countries. We have not done a very good job in protecting people in higher income countries, but in fields that simply cannot support these publication fees. And believe me, I'm not worried about cardiology. I'm not worried about oncology. They have more than enough money to support these fees, but I'm sure worried about pediatrics. Now, I have a soft spot for pediatricians, or public health. It's not like you have a lot of money sitting around, but cardiology and oncology I'm not worried about. So again, I don't have a really good answer for it, but I think there's been a lot of perverse incentives about open access that people hadn't anticipated in the early 20s.
Thank you so much, Howard. This is such a timely presentation. So my question is around AI. So like it or not, AI is here to stay. So I want to get your recommendations and maybe mentorship on how the investigators can leverage AI so that we can become more productive. I think you touched upon some of the aspects already, but for example, with large language models, do you anticipate preprints and open access to be a lot more influential in terms of driving the narratives on certain topics, and therefore maybe investigators are more strategic to then, put their products in those spaces instead of non-open access ones? Or how do we best leverage AI to prepare manuscript, for example, ethically?
So I think trying to confine my comments, there's AI role in discovery science, and I think there's been enough news stories in Nature to say it's fundamentally changing the way in which investigators in certain fields, particularly around protein discovery, that will fundamentally alter discovery science. DARPA, the new HARPA granting mechanism that Biden developed right before, they've given like a $30 or $40 million grant to Broad MIT to use AI to discover new antibiotics. Okay, it's just extraordinary. So you have it in the world of scientific discovery. I just met with someone who's a very senior person, and his group does many systematic reviews before they publish or begin to do research. He now has a large language model do all the systematic reviews. He goes, it's faster, more efficient, and we think better than having a human being do it. So he's leveraging it as a way to understand before they do additional research, what does the systematic analysis of data say to them? So I think that will just continue to become more extensive, and depending upon your field, people will learn how to use it in terms of discovery or background information. I think it's inevitable that journals will change their mind and simply say, if you've used AI in any aspect of the submitted manuscript, please detail how you've used it. Have you used it to do the background? Have you used it to generate the references? Have you used it to do the data analysis? Have you used it to help edit the manuscript? It will be very similar if you look at JAMA at the end of JAMA manuscripts. We say how authors contributed, and someone wrote a very nice piece about saying that's exactly what you should do with AI. I think journal editors have really struggled. I was really surprised about the initial reaction saying AI shouldn't be used. And I felt like this came from 2 or 3 people who champion fairness. And we know if the manuscript is poorly written, it's much less likely to get accepted, or if it comes from a less prestigious institution. So I've said, God, this seemed a little odd to me. Well, they've changed their tune. So I think they will ultimately change their tune about the use of AI. But when you're thinking about submitting a manuscript to a journal, you really need to understand what their instructions to authors say. At this point, I think they want you to detail how you used AI. What I'm concerned about is if editors pronounce in different ways that they're uncomfortable with the use of AI, I'm concerned that that will then impact how peer reviewers think about it. But I can tell you, people under 30 or 40 are using AI in every aspect of their life. Why do you think you wouldn't use it in science? So I think it's old people like me that may find it objectionable, but young people are simply going to say, have a nice life and retire. It's coming, and I think it's going to come so rapidly, it's almost impossible to resist its use. As I said, I just can't imagine that AI tools will be used to help editors make evaluation of papers at virtually every journal in the next coming years. Okay. Any more?
Well, thank you so much for joining us.
Thanks, everybody.